Hello, everyone. Welcome to our lecture series. I am Dr. Mansi Sauji. I have finished MD in Swasthavatta and Yoga, and I've been practicing since 7 to 8 years. Uh, the topic for today is going to be dietary approach to specific digestive disorders. So let's dive right into it. Yes. So why did I mention specific digestive disorders? Now we know that digestive disorders is a vast term and it includes all the digestion related issues. But here we are going to be covering, basic or very commonly found digestive disorders and the way they are shown or manifested in day-to-day lives. Now, when it comes to digestive disorders and having a dietary approach to management of digestive disorders, we need to understand one thing. Either patients come to us with a diagnosis. So there's already a tag on them that I have celiac disease and I need a diet for celiac disease. Or they might say that I am constantly suffering from this symptom. Earlier, I used to have on and off, but now I'm just not able to get rid of it. And I've been taking over-the-counter medications for this digestive issue. But now I want to, regulate my diet and lifestyle in such a way that my simple things like acidity, gastritis, very common issues, but then if they are recurrently seen, more frequently seen, the patient or client gets alarmed and then somewhere they get aware that something related to their diet is wrong and they might come to you to help them manage their digestive issue. So the symptoms that they have could be the starting of something bigger. So we need to understand both the basics of the diseases that we're going to talk about today and how to tackle those diseases through that. So firstly, what we're going to go through is what digestive disorders are and their types very, very quickly. And then we are going to cover acid peptic diseases, irritable bowel syndrome, inflammatory bowel disease, and celiac disease in this lecture. So what are digestive disorders? Digestive disorders are conditions that disrupt the normal functioning of digestive system, leading to various symptoms like bloating, constipation, diarrhea, abdominal pain. So this is a vast and extensive term for all the digestive disorders, all the digestive issues, basically. Now, these are just example: bloating, constipation, dyspepsia, gaseous distension of abdomen, or say constipation. So all of them come under digestive disorder. And basically, to divide the digestive disorders into types, depending on whether they involve structural abnormalities or functional issues, we are going to divide them into structural and functional. Why? Because most of the structural disorders related to digestive system need or may need a different approach along with the dietary approach. Like, for example, there's obstruction, intestinal obstruction. It might need a totally different approach. And in fact, surgical view of the disorder is even more of a priority than the diet when it comes to such diseases. So there are a lot of them which come under surgical purview. But most functional disorders, they can be taken care of through conservative and dietary approach. So basically, we need to be able to differentiate between whether the digestive disorder is structural or functional. And if it's functional, yes, we can go ahead and give the dietary support to it. But if needed, we need to counsel the patient or client if they have not yet undertaken other major important approach or management approaches. So that plays a pivotal role in functional digestive disorders. At times, a primary and sole approach to functional digestive issues could be dietary changes. However, the approach to structural digestive issues requires a surgical management prior to or along with the dietary intervention. So please keep that in. Now we move on to our first disease of today's lecture, which is acid peptic disease. Acid peptic diseases is a group of conditions caused by an imbalance between the digestive tract's protective mechanisms and the damaging effects of stomach acid and digestive enzymes. Now, this is characterized by imbalance between acid secretion in the body and the natural gastric mucosal defenses, which are digestive tracts. If there is a barrier between them, of course, nutrient absorption is going to get hampered. But if there is something called ulceration or wound on your digestive tract, then acid peptic disease is going to manifest in terms of, say, heartburn, in terms of abdominal pain, in terms of bleeding in the abdomen as well. This mostly involves peptic ulcer diseases, gastroesophageal reflux disease, and dyspepsia, and can affect the organs like esophagus, stomach, duodenum, common. We're going to address the causes of acid peptic disorders or diseases for Nidan Parivarjana so that better management protocol is set. This may happen due to excessive acids and pepsin, which may happen in people who are mostly concerned with pitta constitution. Pitta constitution people naturally tend to develop, especially if they're eating more pittakara ahar or pitta increasing food items, then they might experience excessive acid and pepsin. It is primarily caused by excessive presence of acid and pepsin, which irritate the damage the protective lining of stomach and other parts of the digestive tract. Now, most patients or most clients may come to you with already diagnosed gastritis. So I have recurrent gastritis and I'm taking medications for gastritis. How should my diet be so that it will support my medicines as well and avoid the triggers that I have when it comes to my gastritis? Second cause could be infection like Helicobacter pylori, which is very common in gastric and duodenal ulcers. And along with the dietary approach, proper medical management, conservative management of infection needs to be done simultaneously. The third cause of acid peptic diseases is stress. Due to stress, there is excessive stimulation of vagus nerve, which supplies to our stomach or digestive tract majorly, and which results in excessive acid and pepsin. Okay. So these are very common causes related to acid peptic diseases, and which we need to know while approaching the digestive disorders for diet. The symptoms usually are commonly seen in the form of heartburn, abdominal pain, nausea, vomiting, bloating, indigestion, dyspepsia, difficulty swallowing. Now, what is the dietary approach to acid peptic disease? First of all, for any disorder related to digestion, or any disorder for that matter, when we design a diet for any client or any individual, we need to understand that addressing their present state of Agni or digestive capacity and what kind of samata or what level of samata is currently present in the body. Assessing that is very much important. First, if you assess that, if their Agni is on the lower side, if they have Manda Agni, if their digestive strength is poor, they are unable to digest food, no matter how much dietary changes you make, you will not see the results which you will see if you address the Agni and Am state or gland. So addressing Agni, if needed, Agni Deepana food items and Ama Pachak food items are necessary along with the other approach for that specific disease. Now, this is going to be applied, this point is going to be applied for every disease that we are going to address in this lecture. Second is Nidan Parivarshan, dietary. We say to each its own. No matter how much generalized dietary approach or standard operating procedure, dietary procedure, we keep designed for all the clients to that specific disease. Still, you are going to find some clients which have a unique characteristic or unique response to certain food items. So there could be two people with acid peptic disease with the same diagnosis. One could have a problem with the ingredient and other could be completely okay consuming that ingredient. So it's very much important to understand what are the triggers for the particular client, and the client knows it very well. They just need to be made aware that this food ingredient is creating a harm for you. Now, let me give you an example. Consuming salad is considered healthy, right? And one of my clients came to me because they were having recurrent acid peptic amlodkar, acid peptic symptom, continuous amlodkar and dyspepsia, discomfort after consuming food. And when we evaluated his diet, he had a habit which he recently took up, by the way. And since he took up this habit, he started experiencing more digestive discomfort and digestive issues. And the habit, apparently healthy habit, which he thought, consuming raw carrots along with every lunch. That was a rule that he had made. He used to consume a bowl of raw salads with his lunch, and that was creating issues. What I suggested to him was a small shift. Just boil the carrots that you're consuming with your lunch. And there was a dramatic decrease in his discomfort or his acid peptic issue. So it's very important to understand, even if the client is eating something that is apparently healthy, considered apparently safe, it may not be working for him or her in the way that it should. So evaluating such things is also of utmost importance. In most digestive disorders, raw food or eating raw sprouts, in fact, triggers their symptoms. And you will see that if you ask such questions to multiple people suffering from digestive issues. When it comes to acid peptic disease, Nidan Parivarchana, like I said, is the second thing that we need to consider. So what are the triggers and avoiding those triggers? It's very, very important. Here we are addressing digestion, but the triggers also could be related to stress. The triggers also could be related to sleep issues. The triggers also could be related to the occupation that they are in. So a thorough, holistic approach while evaluating the triggers will certainly help. Third is Pitta Shamana. So food items that decrease the increased Pitta is very important. So examples include grains like wheat, barley, oats, fruits like watermelon, grapes, apples, vegetables like cucumber, green beans, zucchini, spices like coriander, fennel, help in reducing the. Third is Rasavardhana. Rasavardhana, food items that are hydrating, cooling, and nourishing in nature, especially nourishing to the Rasadhana, the plasma and lymph tissue in the body. they are going to help in asymptomatic disease. Of course, your overdoing is certainly not going to help. For example, if a person already has mandagni, and for increasing their rasa, if we typically advise them proper hydration, drink lots and lots of water. If that's a general tip given to them. By the way, I'm going to address giving general tips related to diet, just distributing tips on social media and how it can backfire on the clients. I'm going to address that as well. So basically, if a lot of water is consumed, especially at the start of the day, if people are consuming liters of water, this might affect their acne and this might trigger their acid peptic disease or any digestive disorder for that matter. So addressing the thirst cues from the body timely is advised, and we need to advise that. Next, symptomatic treatment, if there is nausea, if there's heartburn, if there's vomiting, dietary approach or dietary solutions to the symptoms. Like fennel is very good in nausea. So fennel infused water, sweet basil infused water for heartburn, licorice for vomiting. Licorice, especially with cold milk and rock sugar, it helps in reducing the acidic environment. Basically, treating acid peptic disease is normalizing the pH of the stomach. And finally, if there is ulcer majorly, or if there's bleeding in the abdomen, if there is wound in the abdomen already, ulcers, then Brunner Opak food items are going to help, like turmeric, like licorice. Now, when it comes to lifestyle, dietary behavior that needs to be taken care of in acid peptic disease, first, avoid lying down immediately after, especially in conditions like gastroesophageal reflux disease, where client after consuming meal, if they immediately lie down, or even not immediately, if they lie down within the half hour or 45 minutes of consuming meals, they will experience the regurgitation of digestive juices. So avoiding lying down immediately after meals should be advised. Avoid this triggering factor. And yes, practice mindful eating. Why practicing mindful eating is important? Because yes, this slide shows you what should be consumed, but what should not be consumed is of even more importance than what should be consumed. Because if the triggering food items are consumed, like sour food items, very spicy, masaledar food items, if a client has habit of eating outside, bottling continuously on a regular basis, the triggering factor or nidan parivarjana is not happening. Heavy meals, such things are going to, or eating bakery food items, eating junk food, oily food, fried food on a regular basis. This is all going to add to the symptoms related to acid peptic disease. So practicing mindful eating, avoiding the things that should be avoided, is of even equal importance when it comes to management or dietary management of any digestive disorder. What are the examples of recipes that we can suggest in acid peptic disease? Like I said, to each its own. So all the recipes might not apply to all the people. For example, if you consider there's a person with acid peptic disease but is also lactose intolerant. So most of the recipes that we have mentioned here do not address that. You need to take into consideration if they're lactose intolerant or if they have any other condition like diabetic person who is having acid peptic disease. The approach needs to change. So please be mindful while tackling with. Here are just examples of the recipes that are going to help in Pitta Shamana, Rasa Vardhana, and like I said, Vrana Ropana at a time, which you can suggest in acid peptic disease. Licorice milk, adding rock sugar. Gulkan milk, adding gulkan to milk. CCFT, coriander, cumin, and fennel. If it is infused in the water or kept overnight and strained in the morning, this can be consumed throughout the day. Turmeric rice, especially in peptic ulcers, especially duodenal ulcers, if a lot of liquid diet is consumed, it is seen that the symptoms are triggered. So the patient or client is advised soft diet in such cases. So advising turmeric rice, soft turmeric rice, which is evenly cooked or boiled, helps in such cases, instead of just asking them to consume liquids. Lajamanda or puffed rice gruel cooked with turmeric, adding option. Sweet basil seeds, cucumber, and mint infused water. This works wonders in acid control. And like I said, coriander infused water. Now here, Sheet Jala does help in tackling with acid peptic disease. But how much is consumed at a time is also important. So please be mindful of it. This was about acid peptic disease. Next, we are going to move on to irritable bowel syndrome. Irritable bowel syndrome is a functional gastrointestinal disorder characterized by recurring abdominal pain and altered bowel habits such as diarrhea or constipation without any visible signs of damage or disease in the digestive tract. So usually you see irritable bowel syndrome, IBS with constipation or IBS with diarrhea. And there's another scenario where you see IBS mixed, where there is alternate diarrhea and constipation. And here the client is exhausted with the symptoms. Let's first address causes of IBS. While the exact cause of IBS isn't fully understood, factors like gut motility, hypersensitivity, infections, stress, and genetics may play a role. Mostly there is a research which says a neurogastrointestinal disorder involving interaction between the brain and gut. And most of the digestive disorders are linked with stress. And there are a lot of researchers supporting this. So addressing stress does play a role. But yes, again, addressing the triggers through diet is much more important. The most common symptoms include abdominal pain, bloating, changes in bowel habits like diarrhea, constipation, or both. It's a functional disorder. IBS is a functional disorder, meaning the bowel may function abnormally, but all the tests are normal. Everything is normal, but I am having an issue. It's mostly the kind of statement that the client gives when they have irritable bowel syndrome. There is no visible damage. IBS does not involve structural changes in the digestive tract, unlike inflammatory bowel disease. Chronic but manageable. IBS is a chronic condition, but can often be managed with lifestyle changes, diet modifications, medications, and possibility. Diet plays a very important role in management of irritable bowel syndrome because clients go through irritable bowel syndrome years together, and building their confidence through the diet that suits them is very much important and our responsibility while giving them the dietary guidance. Now let's see the dietary approach to IBS diarrhea. Of course, the first thing that we're going to address is Agni and Ama and give proper guidance related to Deepan Pachan. Second is Nidan Parivarjan. Like I said, what food item triggers the symptoms should be avoided. And for that, proper history taking and questioning and interrogation is very much important when it comes to finding out or evaluating the things that are triggering the symptoms. Third is the dosha correction. Especially in IBS diarrhea, we need to address pitta and kapha dosha, and we need to give pitta kapha shamak ahar. So food items that are cooling in nature, that are light to digest, easily digestible, while avoiding heavy, oily, and spicy foods is very important. Rasavardhan, hydrating, nourishing food items. Nourishment to the plasma nutrition. Purish Sangrahaniya. So the food items that help in proper binding of the bowel contents, which helps in turn in diarrhea. And finally, Sambhakaha, which is also going to support Puri Sangrahan, but also going to reduce the symptom of diabetes. The examples of Sambhakaha is finger millet, pomegranate, nutmeg, of course, in proportion. Let's address the dietary approach to IBS constipation. IBS constipation, again, addressing Agni and Ama initially, Nidan Parivarjana. That is going to be common for all the digestive disorders. Here in constipation, majorly Vata is increased. So Vata Shamak Ahar is going to help in tackling with constipation. What does help in Vata Shavana? The food items that help in Vata Shavana are cumin, ghee, wheat. Now, when it comes to wheat, you need to be very conscious if this is a triggering factor for the IBS person. While advising wheat, be very careful, and it's always better to have substitutes for wheat handy and advise them to the clients so that if that is a triggering factor, they will avoid it altogether. Rice is mostly mild on the gut and it works for most of the clients. So if you substitute wheat with rice, it does help. If you substitute wheat with sorghum, it does help. But again, when it comes to Vata Shavana, sorghum increases Vata dosha. So consuming it with ghee avoids triggering Vata. Next is Rasavardhana and Anulomana. Anulomana food items for constipation, along with the other dietary approach that we discussed, does help in IBS constipation. So carom seeds infused water, ginger infused water does help in Anulomana. And carom seeds are ajwain, ginger infused water does. And like I said, dietary behavior is very important, reminding the clients that they need to change their behaviors and avoid these things at least. So practice mindful eating when it comes to IBS, no matter diarrhea or constipation, and avoid gulping down food in haste. Basically, to the modern man who's in a hurry constantly, it is very important to remind them that eat your food with mindfulness. Let's address the examples of recipes. Let's just go through them. Laja Manda, Mudga Yusha, ghee in milk or warm water, mildly spiced soups and curries, porridges, pomegranate juice, and infused water. They help in IBS. Let's move on to inflammatory bowel disease. Inflammatory bowel disease, or IBD, is a chronic condition characterized by inflammation of digestive tract, primarily affecting the colon and small intestine. There are two types of inflammatory bowel disease. One is Crohn's disease, and second is ulcerative colitis. In Crohn's disease, this may affect any part of the gastrointestinal tract, right from the mouth to anus. It often involves deeper layers of digestive tract and can cause skip lesions, areas of inflammation surrounded by normal tissue. It's called skip lesions. Ulcerative colitis, however, is primarily affects the colon and rectum, the lower part of the digestive tract, causing inflammation and ulcers in the inner line. So basically, Crohn's disease can affect any part of the gastrointestinal tract, and ulcerative colitis mainly affects the large intestine, colon and rectum, and the distal part of the large intestine. Let's address the causes quickly to help in Nidan Parivarjana. Again, exact cause of IBD is unknown, but it is believed to be a combination of genetic predisposition, environmental factors, and dysregulated immune response to gut microflora. Common symptoms include diarrhea, sometimes with blood, abdominal pain, weight loss, and fatigue. Here, the thing to mark is weight loss, which we've not seen so far. So basically, IBD comes with weight loss, fatigue, fever. Basically, there are signs of inflammation in the body. IBD can significantly impact a person's quality of life, causing physical, emotional, and social challenges. Long-term health. IBD is a lifelong condition, and managing it effectively is crucial for preventing complications and maintaining overall health. So, there is a factor of stress which is triggered due to inflammatory bowel disease, which in turn triggers the symptoms of inflammatory bowel disease. So the patient or client is already frustrated because of the disease, stress out, and they trigger the symptoms of inflammatory bowel disease. So proper counseling and proper motivation when it comes to IBD is our responsibility as we are guiding the patient through the disease. Here is the dietary approach addressing Agni and Minar Parivarjana dosha correction. Mainly Vata and Pitta need to be addressed when it comes to inflammatory bowel disease. So ingredients like wheat, ghee, coriander, bottle gourd. Rakta prasadana, like turmeric, pomegranate, dates are going to help in Rakta prasadana. Stambana, finger millet, pomegranate, nutmeg are examples that help in Stambana. And grahi food items and pranava. Pranavopak, we've already discussed examples are turmeric, licorice, they help in pranavopana. Again, to each its own, what are the triggering factors? What works for whom? Along with the food items that help in all these goals is important. Dietary behavior, avoid overeating at a time and practice mindful eating. Overeating at a time may be a triggering factor commonly seen in IBS, IBD, inflammatory bowel disease, and should be avoided. Here is the examples of recipes which commonly help in IBD. Now let's move to celiac disease. Celiac disease is an autoimmune digestive disorder. It's a long-term autoimmune digestive disorder. It primarily affects the small intestine. So patients develop intolerance to gluten, which is present in foods like wheat, rye, spelt, and barley. Celiac disease was first described in childhood. However, it may develop at any age. Celiac disease is caused by reaction to gluten, a group of various proteins found in wheat and other grains such as barley and rye. On exposure to gluten, an abnormal immune response may lead to the production of several different antibodies that can affect a number of different organs. In the small bowel, this causes an inflammatory reaction and may produce shortening of the villi, lining of the small intestine, which is also called as villus atrophy. And this affects the absorption of nutrients frequently. So celiac disease comes with, of course, a weakened immunity, but it also comes with nutrient deficiencies. So tackling with celiac disease along with the nutritional support is a kind of holistic dietary approach that we can think. Symptoms include the gastrointestinal problems such as chronic diarrhea, abdominal distension, malabsorption, loss of appetite. And mainly in children, growth is hampered. Again, when it comes to dietary approach, addressing Agni and Ama initially is of utmost importance. When it comes to Nidan Parivarjana here, gluten or anything that contains gluten should be completely a no-no for the patient, for the client. Substitutes that are healthy and that can be substituted to wheat. Instead of wheat, they can have rice, quinoa, buckwheat, corn, sorghum. There is a lot of things where there is a lot of range of things available, diet ingredients available as substitutes to gluten. So it's not like gluten is the be all end all of food. There are various nourishing food items like the examples that I gave you and other examples that we find that people are already consuming, which is helping them in tackling with the celiac disease. So it's not like there is no solution to it. We just need to help our clients so that they'll find them and use them for their own. Here, we need to mainly address Pitta and Kapha dosha. So foods that are cooling, light, and easily digestible, especially avoiding heavy, oily, and spicy foods. Again, here, what to avoid is of more importance than what to eat. So, counseling the clients or motivating the clients to do so, again, falls on us. Rasavardhana, hydrating, nourishing, cooling food items, grahi, For example, dry ginger, moth beans, brown rice, they're grassy in nature and they help in tackling with celiac disease. Again, even if I say moth beans, avoiding sprouts and uh, addressing that during the consultation, diet consultation is very important. Even if sprouts are healthy, of course, Ayurveda has mentioned that they are not recommended. But we also need to remember another thing, that the effect that it has on the body is evident. And that's why sprouts need to be avoided, especially raw sprouts. When it comes to dietary behavior, avoid overeating at a time, and practicing mindful eating does help along with the dietary changes that we make. Here is an example of recipes that do help in uh, celiac disease. You can take down or take a screenshot. We are at the end of our lecture, and before we part ways, I would like to give you an assignment, which will help you, of course, to summarize what we have learned today and go back wherever needed for doubt. But again, find your own creative zone, explore your own creative zone when it comes to finding or designing the recipes according to the diet that we have addressed for each disease. So we have we have discussed the dietary approach for acid peptic disease, irritable bowel syndrome, inflammatory bowel disease, and celiac disease. So according to the goals that we have mentioned in our slides today, what recipes you can come up with? If you can find one each recipe, it will really help you explore your creative zone. And enlist the ingredients that substitute lactose for those who are lactose intolerant. So that is all for today. Thank you so much. See you soon.